to the first mediations presentation of this academic year, titled Big Data and the Digital Health Landscape. It's the physical distancing edition of mediations. For those of you who don't know me, my name is Charlotte. I'm a second-year PhD student in media studies. I'm going to be moderating today's session if my Wi-Fi permits it, hopefully. Okay, yeah, before we begin, I would like to take a second and acknowledge that Western University is located on the traditional lands of the Anishinaabe, Haudenosaunee, Lenape, and Arawandron peoples on lands connected with the London Township and Sombra Treaties of 1796 and the Dish with One Spoon Covenant Wampum. This land continues to be home to diverse Indigenous peoples whom we recognize as contemporary stewards of the land and vital contributors of our society. Moving on to just a little bit of housekeeping. So this session is being recorded with the speaker's permission. We kindly ask you to keep yourself muted for the duration of the talk. The presentation will last for approximately 30 minutes, and after that, we will certainly have some time for discussion. So if you would like to ask a question or make any sort of comment to our speaker, please use the Zoom function to raise your hand. For those of you who've never used this function before, you can find it by clicking on the participants bottom that should be on the bottom of your screen, and then a little hand shows up on the bottom of the list. Click on that and we will call your name. Because this is the first mediations talk of this academic year, and there might be some new graduate students and new faculty members with us today, just a little bit of background. Mediations is a completely graduate student-run workshop and guest speaker series at FIMS. And the goal of mediations is to display the rich diversity of research and scholarship being pursued at FIMS to the FIMS community, but also to the broader Western community. And with that said, I would like to introduce today's speaker. Danica Facca is a third-year PhD student in health information science working under the supervision of Dr. Lorie Donelle. Danica holds a BA in English literature, first major, and a second major in criminology, as well as an MA in English literature with a graduate specialization in transitional justice and post-conflict reconstruction from Western University. She identifies as a digital health researcher and is primarily interested in children's digital health literacy skills and engagement with digital technologies in a Web 2.0 context. Danica has published on topics related to digital health literacy, digital health technologies, and conducting qualitative research with children in journals like the International Journal of Qualitative Methods, Health Science Inquiry, PLoS ONE, the International Journal of Qualitative Studies in Education, and The Conversation Canada, respectively. Her other research areas of interest include data politics, post-human ethics, surveillance, and qualitative methodologies. Danica currently holds graduate research assistant positions in Western School of Occupational Therapy and at the Labatt Family School of Nursing. She's also serving as the Vice President Academic for Western Society of Graduate Students for the 2020-21 academic year. And now I would like to hand over the floor to Danica.
Thanks, Charlotte. I'm going to think I need to someone needs to stop their screen sharing. Is that you or Effie? Just so I can take control of the...
That was me, I stopped it.
Oh, you did? Okay. There we go. Thanks, Effie.
You're welcome.
Alrighty. So I am presenting to you from Canva today, which is my favorite platform to do kind of PowerPoint work. So with that said, thank you, Charlotte, for doing the long-winded introduction for me. Again, for those of you who don't know me, I am in the third year of my PhD in health information science, and I get to work with Dr. Lorie Donelle, who may pop in today. If not, she knows it's being recorded, so I will send that her way. She's fantastic. So thank you also, Charlotte, for doing the land acknowledgement, because that is something that I've already predetermined that was going to be part of my talk, but we can just go on and skip through that. So as Charlotte noted, I am really fortunate to hold various research positions throughout Western and through different health-related communities. So the talk today that I'll be giving is going to report on two separate but complementary studies funded by the Health Sciences and SSHRC respectively, and they are all under the instruction of my supervisor, Dr. Donelle. So the first part will share some preliminary findings from a qualitative descriptive study, which is the Transition to Parenting. And this employed focus groups to understand new parents' experiences of using digital technology throughout 4 stages of their transition into the parenting role. So prenatal, pregnancy, labor and delivery, and then the postpartum context. And the second part of the talk will report on a related but also recently published study that I was very fortunate to be given first author permissions on that, which explored existing literature to canvass the ethical concerns and challenges when using what I'm going to explain as digital data collection strategies in research with minors. And this project has an intent to inform methodological approaches for a much larger multidisciplinary team under Western Health Sciences that's looking to pursue a cohort birth study in relation to digital health. So with that out of the way, I want to just take a minute to briefly kind of unpack this term digital health that's been tossed around already. So as it's been mentioned by Charlotte in my bio, but then also as it relates to the work that's before you today, the field of digital health is quite emergent. There are ways in which it intersects with other fields like ethics, like health studies, like nursing, but it's its own particular discipline for specific reasons. So one of the leading scholars in this field, Dr. Deborah Lupton, who's down at the University of Canberra in Australia, has a work that I believe came out in 2016 that I've cited here, but then she also has more literature that's been published up until this past spring that's all related to digital health and helping to define the field. So to take a lead from Deborah Lupton, the quote before you today reads as follows. So digital health, quote, refers to a wide range of technologies directed at delivering healthcare, providing information to lay people, and helping them share their experiences of health and illness, training and educating healthcare professionals, helping people with chronic illness to engage in self-care, and encouraging others to engage in activities to promote their health and well-being and avoid illness, end quote. So digital health really resides at this intersection of emergent technology with the healthcare system and the ways in which lay people not only interact with the healthcare system, but take up their own self-care practices. And as the World Health Organization defines it, health is an overall state of mental, physical, but spiritual well-being. So health writ broadly, in a sense, is just how you're doing overall as a person. And then we can further delve into the ways in which there are social determinants of health, or the ways in which you are situated socially and culturally with respect to your identity, your socioeconomic status, your race, your gender, your sexual orientation. All of those really interesting parts that make up who you are influence the ways in which you can manage your health, how your health may be perceived by others, and the resources and availabilities that are offered to you. So with that said, let's move on into the first study that I'm really excited to talk about. So this one is the transition to parenting within the context of digital health. So let's meet this really stellar team. So the first multidisciplinary team I get to introduce you to is again headed by Dr. Donelle. So Dr. Donelle is within the Arthur Labatt School of Nursing. She is also a core faculty member, cross-appointed in health information science, and also part of the Lawson Research Health Institute. We have Dr. Jody Hall, who is over at Fanshawe College at the School of Nursing. Jody is also a certified doula. We have Dr. Kim Jackson, who's also in the School of Nursing and does the collaborative coordination for the Bachelor of Science in Nursing program. We have our recent graduate, Dr. Bradley Hebert, who just got his PhD in HIS not too long ago, and he's now working as a research associate at the School of Nursing under Dr. Donelle, and he also works as a program evaluator over at Huron Perth Public Health. We have Jessica LaChance, who is an RN, but is also pursuing her PhD and also works as a nurse interventionist at Western. And then we have Eolina Cisnall, who again is also a nurse and is pursuing her PhD as well. And she currently works as an RN in the neonatal intensive care unit. And then they got me. So together we have quite a really diverse but largely health-focused team that touches on so many areas. And that's why this study has been such a privilege for me to be a part of and learn from all of these scholars in their own ways in which they practice healthcare or research healthcare. So to give you a bit of background on this study, the findings that I'm about to share for you are, again, from a much larger descriptive study, and we're just taking a small piece at the intersection of surveillance and motherhood for today. So again, the purpose of this study overall, writ broadly, is to see the ways in which digital technology contributes to experiences of the transition to parenting in terms of structuring emerging pregnancy and early parenting practices. So these findings are from phase 1 of the project, and phase 2 that will be informed by this work will look at fathers' use of technology as a new parent to further get at gender divisions of parenting and labor. And I'm really interested to get to that perhaps in the Q&A after. So the knowledge translation outcomes of this particular study are looking to include a safe parenting tech database that will house vetted technologies and apps to support new parents as well as clinicians. And then further findings of this research will contribute to clinical education and practice by informing health policy development related to parental safety online resources and overall equitable access to quality online health information for parents or expected parents. So in all, surveillance was identified as a pervasive element of the experience of the transition to parenting. And as a result, these findings will be shared in a forthcoming manuscript that's focused on digital surveillance and motherhood within the context of our digital landscape. So it's really important for me to note here that what I'm going to be talking about is the ways in which mothers are largely responsible for family care, and as such are expected to gather, evaluate, and understand health information to support their own self-care as well as the care of their spouses, children, and other family members. So the plight of mothers' health information gathering practices is compounded by gendered virtual vitriol and algorithmic inequities. The study took place during 2018 and 2019 in an urban setting in Canada. Propulsive sampling was the strategy initially used in addition to snowball sampling to reach participants. Recruitment was done with flyers as well as through social media. And the flyers were posted in places where parents typically frequent, like daycare centers, public health units, family clinics, and early play centers, So inclusion criteria, parents were eligible to participate if they identified as a new parent within the last 2 years, if they were between the ages of 16 to 35, and if they were English speaking. So data analysis and collection occurred concurrently. Focus groups were conducted by the team in locations agreed upon with the participants, and this included public libraries, a shelter, and a children's center. So the nature of inquiry within the focus groups was related to, again, the participants' use of digital technologies, and this extended to include, which you'll see in a moment, social media, pregnancy parenting apps, as well as participation in online pregnancy and parenting support groups. A demographic questionnaire was provided to each participant to collect descriptive characteristics, and then data was digitally recorded and transcribed concurrently with thematic data analysis, as well as the team's field notes in order to capture data that was not, again, easily picked up by the recording. So this would be like nonverbal communication and body language and things of that nature. So moving on to just give you a snapshot or capture of the demographics. Overall, the participants' age distribution was relatively split between having younger parents under the age of 20, and then a pretty hefty distribution in the 30 plus category. In terms of gender and sexual orientation, as well as ethnicity, all of the participants that phase 1 is dealing with and of the findings that I'm about to share with you happen to be mothers. And that's a reason why phase 2 is really interested in looking at the father's perspective. So all the participants identified as heterosexual women, with the majority identifying as white, and the rest of the participants identifying as a visible minority. In terms of education and employment status, most of the participants completed high school and or they had high school with a post-secondary undergraduate degree. And in terms of employment status, a large portion of them were unemployed. And this again could be attributed to maternity leave or taking time off to care for their new infant, or perhaps they are again with child and are expecting to go into labor. In terms of socioeconomic status and marital status, for socioeconomic status, again, it was mixed. And if you may note that the numbers in each slide don't particularly add up, just because I left out capturing the participants that just chose not to answer specific demographic questions. But overall, what you have before you is at least there was a healthy amount that were within the 50K plus for SES and annual household income. And then in terms of marital status, a large portion of our participants were married. All right, so let's dive into this surveillance thing. So when we're thinking about the pervasiveness of surveillance in the transition to parenting, particularly as it relates to motherhood, our team has started to draw on feminist literature. So within our contemporary digital context, feminist scholars highlight how neoliberal governance is legitimized and enacted through professional knowledges and practices about risky or problem bodies. So understood through the lens of Foucault's biopolitics, bodies under our contemporary neoliberal state are self-governed according to the logic of individual responsibility and risk calculation. So in other words, individuals are tasked with the management of social or health risks, and as such, they engage with technologies of self, so the practices and behaviors of their own self-management. So in particular, the pregnant body falls under intense networks of surveillance under neoliberalism, given that it's solely responsible for nurturing a fetus as a potentially healthy future citizen, laborer, and contributor to the economic well-being of the neoliberal state. So under the logic of this kind of citizenry, expectant mothers are compelled to mitigate health risks by engaging in rigorous regimes of self-surveillance and management to make sure that they achieve a healthy pregnancy, regardless of their social or material circumstances. So this form of individual responsibility and self-governance is something that can be understood as maternal responsibilization, which some scholars note have been progressively extended in recent decades as technological developments and reproductive visualizing technologies have advanced and become more mainstream. So we have advancements in visualizing technology to attribute to the intensity of maternal responsibilization, as well as the rise of smartphone apps and social media. And as such, mothers are placed in this context of almost reproducing and reinforcing tropes of motherhood, which can include, the stay-at-home mom, the overextended mom, the technologically dependent mom and mother-to-be. So ideals of good motherhood or mothering, so the extent to which expectant mothers or new moms intensely self-monitor and engage in risk mitigating practices to ensure the health of this future child or citizen, are continually performed, reinforced, and almost expected across digital platforms. So from a feminist perspective, analyzing tropes of motherhood as they relate to surveillance can offer insight into how the experience of transitioning into the new parent role within a digital health context aligns with stories about motherhood and different opportunities for mothers to either break down or re-adhere to traditional modes of femininity. So let's start talking about self-surveillance. So as an extension of their maternal identity, participants in this study adopted a range of self-governance strategies that were either enabled or prompted or mitigated at the direction of digital technologies. And for a lot, that began pre-conception. So we have some quotes here that relate to period tracking as well as fertility tracking. So as you can see, participants said, period tracking, it was a job. But I found that when I was following it so stringently that I was almost obsessing over it. It's gotta be this day, and then it didn't for my body. It didn't really work that way. I used a fertility app to know when I was ovulating. And then when I got pregnant, I used another app to show what the baby was, if it was the size of a watermelon or if it was the size of an apricot or whatever. Surveillance was also picked up in a relational context. So this is where self-judgment and doubts were sometimes introduced or amplified by partners and or family members of these mothers. So this is one long continuous quote. Like I would be feeding her, the baby, and I would be looking at these chat groups or scrolling Facebook or whatever. And my mom was like, "You're not bonding with your daughter. Stop that." She's like, "Give me your phone." And she'd like literally take it away from me when I was with her. And I'm like, you're right. I mean, I'm guilty of it, certainly. Like in the middle of the night when she's up and I need to keep myself awake here. Surveillance has also been picked up at the systemic level. So there were times when participants had their digital activities governed or ascribed some kind of moral judgment when they were accessing services, community spaces, or seeking healthcare. So we have 2 quotes here. The first, like, I do know Facebook, right? Like all those things are free because they're getting data about us and like using that to sell us. Like, so yeah, I guess I don't really want them to have information that they don't need to have. And the second one, I remember like the first doctor's appointment or one of the first I had after she was born. The first thing my doctor said was no screen time before 2. And I was like, screen time? What's screen time? I had never heard that. And she goes, "You'd be surprised how many parents will pop their baby in front of an iPad or a TV as young as a couple months old, and they just sit there." And I was horrified. So from all accounts, surveillance was pervasive. But now let's get into a little more interesting part of what we're teasing through with the data in terms of resistance. So there was no place within our study so far where mothers could turn, where they did not carry the burden of decision-making and the responsibility for their well-being in a climate of digital technology. And yet, while they were on the receiving end of constant evaluation and moral judgments of their parenting practices, some had moments of resistance. I got a baby monitor once and I just kept checking the baby monitor. I pitched it and I just opened the window when I'm outside, right? Like we used to do before we had. And so we lived on like 2 acres growing up and my mom was outside, like it didn't even matter, right? So this participant was talking about pitching out the baby monitor and just, casually checking in on their child through a window, almost, lamenting or nostalgic of the before days when you didn't have, little video cameras in the crib. I hope you enjoy my gift. And another quote from Resistance, this is again one long-winded one. So in reference to an app, "It's supposed to make you more in tune with your body, but you actually start relying more on the app, what the app is versus like listening to yourself." And your mom asked me those questions, like, can you talk through them? Can you walk through them? Like, what are you actually feeling? Like, what are you feeling? Like, what is this app telling you? So I think like if there was more actual like awareness and education around, like birth and labor and what to expect. And I cut the quote purposely because it was long, but I'm really grateful for this participant's input because what they're getting at is, I think, something super interesting, which is the ways in which technology or different, belief systems or social norms that are reinforced through this technology make women, or at least mothers, not trust their inner knowing or themselves. So this mother is coming up against what may be dictated to her through something that she should perhaps be trusting, but there's an inner tension there that she's holding, which is really interesting. All right, so we're going to make a jump over here now, but we're still going to talk about surveillance, just in a little bit of a different context. So our climate of digital technology enables the surveillance of children, as we've seen, well before they are born, even before they are thought of being conceived and brought into the world. But now as we shift context, I want to share a recently published study from another interdisciplinary team, which looked at the ethics of using digital data collection for research purposes. So again, just think about the idea that children now, as they exist out in the world, still have a lot of ways in which they can be entangled with surveillance networks. But what happens when it's at the hands of researchers who are looking to do some kind of good work in order to improve their health? So the team that I'm about to introduce you to is a little subset of a team that's part of a much larger multidisciplinary team that I have the privilege of sitting and working with them as a grad research assistant under Lorie. And, this bigger team has a much larger and ambitious goal, but one that I'm really excited about, which is to look at the multifaceted impact of digital technology on key determinants of health among Canadians from birth to young adulthood. So in particular, the long-term objective is to develop a large-scale, longitudinal, prospective, community-based cohort study. So part of the reason why the scoping review was done is that we want to tease out methodological possibilities in terms of what would a birth cohort study look like? What are the ways that we can collect biometric and screen time data ethically and, have it justified in our research methods? So now a question to think about is, if we want to conduct research with minors to support their well-being as they move through the world, what ethical considerations and challenges arise when using digital tech to survey minors from an academic perspective? So what is the academic community worried about? What should researchers have at the fore when they're thinking through this from an ethical lens? And what's the extent to which we can justify digital surveillance for the purposes of research? So let us meet this team. So I've already gone over Lorie's credentials, but I'm really excited to talk about Dr. Maxwell Smith, who is cross-appointed at the School of Health Studies and also the Department of Philosophy. And he is the co-director and founder of the Health Ethics Law and Policy Lab. With his partner in crime, Dr. Jacob Shelley, who is cross-appointed at the Faculty of Law, as well as the School of Health Studies. And Jacob is also one of the co-directors and founders of the Health Ethics Law and Policy Lab with Max. And then we also have Dr. Dan Labatt, who is part of the Department of Computer Science, cross-appointed with Epidemiology and Biostatistics. So this team is super rich in terms of the different disciplinary lenses they were able to lend to the ways we talked through the data and made it make sense to us. So Max was there as the bioethicist. Jacob brought in the law perspective. Dan came at it from a computer science and epidemiological lens. And then Lorie and I were more on the health information, or at least for Lorie, all of her expertise in the various areas of health that she works in. We had a lot of fun doing this scoping review. So it's a privilege to have it published, but it was just so much fun to work with them and to just have really, really interesting conversations about surveillance. I'm going to leave it at that for right now. So again, the background for this study is located at the intersection of research ethics, digital data collection, and minors. So again, when we wanted to start thinking about this birth cohort study and the ways in which we could collect data, we turned to the literature to see what was already there. And, surprise, surprise, there wasn't that much. So we took up the idea of doing a scoping review to see what was the most recent iterations of work that talked about this from an ethical perspective. So from that, our two research questions, which really informed it and the work, was, does research that involves the generation and or collection of digital data among minors present unique ethical challenges? And if so, what are those challenges and how might research best manage or mitigate these ethical challenges within a digital technology context? So we were interested again in flagging the ethical nuances that came up, but then also thinking about how we can perhaps go ahead with some kind of digital data collection strategy while doing our best to uphold risk mitigation and justify our methodological choices to a research ethics board and our participants as human beings in and of themselves. So the first challenge we had was refining our understanding of digital data. So for our purposes, while digital data sometimes, again, I use this as kind of like a clickbait thing with my mediations talk to get into this idea of big data, which is typically defined by the volume, variety, complexity, speed, and value of the data that can be captured or collected, especially when it's listed between different servers. And then there's opportunities to tease out metadata and analyze, some of the periphery data that just gets collected by virtue of people using a particular service or platform. So for our purposes, digital data, and in the context of this review, refers to electronic data or information, however collected, because we were more interested in the idea that, we aren't just going in with the idea that we want to collect just biometric data or maybe social media captures. It was any data collected through a nuanced digital means. And another challenge, part two, was figuring out the definition of a minor. And we adopted two broad approaches for this. So first, a minor may be defined as any child who has not reached the age of majority, which is generally thought to be under the age of 18. But the problem is that this varies by jurisdiction, especially in Canada. So for example, in provinces like Ontario and Alberta, when you're 18, you're considered to be age of majority. But then in other provinces like British Columbia, you have to be 19. So it just varies by geographical jurisdiction. And then if we go to even like a more specific context, so let's think about what you can do within that area. For example, alcohol purchasing. Within Ontario, the age of majority, you have to be 19, which is suggesting that in the context of alcohol purchasing, although you may be, legal as an 18-year-old, you are still a minor and considered a child or less than an adult status when it comes to alcohol purchasing. So it's a very fluctuating definition. So that was the first approach that we took to understand this. And then the second approach was to define a minor based on this idea of capacity. So again, according to certain ethical guidelines, if a child is maturely sufficient to decide on their own behalf, subject to legal requirements, that they want to participate in some kind of research study, the researcher must seek the children's autonomous consent in order for their participation to be deemed valid. And again, if this isn't possible, then they seek for parental consent and then child assent. So for our purposes, it wasn't important that we resolve the definition of minor, but just to make sure that we were being mindful of the ways in which it can fluctuate between contexts. So our keyword search was intended to be over-inclusive. And we searched scholarly literature using Scopus and PubMed, in particular for articles that explicitly provided some kind of ethical analysis or presented empirical research that directly addressed ethical issues related to digital data in research with minors. And we used 4 categories that you can see here. We did initially consider using the term internet, but we decided to purposefully exclude it because it retrieved a very high volume of irrelevant articles, and it made the search almost a monster to complete. So the term internet is so ubiquitous within the literature that it was just not helping us discriminate between articles that would really serve our research questions and study. So if you're wondering, that was left out. So I have our nice little Prisma table for you here. So articles were eligible for inclusion if they were written in English, discussed our context, subject, and population of interest, and again, provided that explicit ethical analysis or empirical research piece. So after screening, I am not going to take time to read out the numbers. In all, we landed on 20 articles to review, and the majority of them were published after 2014, mostly originated from the US, Australia, and the United Kingdom. And in general, the digital data collection strategies that were flagged throughout this literature included social media, it was the most popular, followed by touchscreen technology, online forums, internet-based surveys, and electronic health record systems. So I know we're creeping up on the half-hour mark, but I'm going to take 6 or 7 minutes just to give you a nice high-level overview of these themes that we ended up analyzing and concluding throughout our data, period, and iterating back and forth between each other of what were the most pertinent ethical issues flagged. So the way in which the scoping review was written is that we take each theme, we talk about its nuances, and then as an authorial team, we decided, is this actually unique to this population of interest? So in all, I will get to the idea that of the 6 you see before you, gatekeeping was the one that we flagged as being the most unique and relevant to this population. And I'll get to that in a second. So when we're talking about consent, which is obviously, and not surprised to any of us, was flagged as an ethical issue, it's this idea that, again, you have to have an individual's voluntary consent. It's the minimum requirement for research participation. So in this sense, especially since, we're considering biometric data and things that are considered to be very sensitive and personal, it was important to read the literature and figure out, okay, well, what is this actual piece about consent in minors? So when it came to discerning whether or not this was, I'm going to say, again, this idea of a unique ethical issue. Although we can get, consent from a parent or guardian, and minors can give the researchers their assent, it was, important that consent be in the conversation. But for us, specifically, one of the things that came up that we note in the review is that, any discussion around consent in a research context, especially with digital technology, regardless of the population, is best handled with what's called a dialogic approach, which just means let's have a conversation throughout the research process. Consent is a process. It is ongoing. It is not a one point in time stamp on we have your approval, now let's just conduct our work. So keeping the conversation open was really important. So for us, again, this is beneficial to any population or any participant in research. So we did not flag it as being ethically unique in this context. The next one that we had to figure out was this idea of data handling. So this involved data encryption, secure storage location, and access to research populations. So in terms of secure server technology and this idea of encryption, as soon as we get into this idea that we're going to use digital means, there is always inherent risk, because when you're opening yourself up to that kind of engagement, there is, again, this concomitant opportunity for some kind of data breach. But again, this is about risk mitigation and figuring out the best tools and having, not ethical certainty, but having an ethical stance as to why it's a justifiable tool in a given context. So again, digital technology, irrespective of the population it's engaged with, is going to open up areas for ethical scrutiny. But all we really concluded from the research was that researchers, if they are going to justify this and use it as a tool, they need to make sure that no hacking, I'll use that term, happens during the transmission, encryption, and storage of their participants' digital data. So again, it's making it a top priority in recognizing the means that they're putting to work with these participants. The next one is minors' data rights. So this one, although it reads as perhaps being unique to this population, it isn't necessarily once we started to tease out what it meant. So data rights, and particularly this idea of children's data rights or minors' data rights, is part of a much larger rights movement influenced by the establishment of the United Nations Convention on the Rights of the Child. And this was in relation to the idea that, again, any child or minor has particular rights related to their movement and opinions and voices to weigh in on matters that affect them. So it's with the rights movement, it really opened up this opportunity to include the phrase that I have unpacked in another article, children's voices, and the weight that that carries, or perhaps the tokenism that invites into those conversations and into those spaces on behalf of children. So we'll put a pin in that. Anyway, so this idea of minors' data rights gets to this notion that cultural and legal practices tend to normalize parents or caregivers' access to minors' data held within government or, broad societal sectors like healthcare and educational institutions, which as a consequence sets up this idea that parents or guardians may have an expectation to have access to their children's data, or whoever they are caring for that may be a minor. So this theme really highlighted this idea that minors have a right to privacy over their personal data, both in an online and offline context. And it's important to uphold and obtain their consent in order to share their data with any kind of third-party adult actor. So although it did gesture towards a unique ethical issue, many of these issues can also, though, be raised and extended to other populations, especially where this idea of the treatment and dissemination of personal data for research participants can advance the agency and autonomy of any participant, regardless of their age. So other populations that, like minors, may have their best interests dictated by external actors, in particular the elderly, those of a low socioeconomic status, or of, quote, a disability background, might argue that where minors differ is their potential to be involved in the research decision-making. The next one that we flagged was this idea of observing behaviors that may result in risk of harm to participants or others. So this is, again, researchers have an ethical imperative to look out for any kind of incidental findings that may be considered otherwise amoral or illicit behavior that could jeopardize the safety of others. And again, what we ended up concluding was that, yes, this does happen in research, and yes, this will happen in research with minors, or just in the nature of the research process in general. But this is not to say that it's going to happen more with minors than it would with an adult population, or even, an older adolescent population, to be more specific, or like young adulthood, I would guess. So, like the 18, 19, 20 mark. Moving on, one of the last ones to touch on is this idea of private versus public conceptualizations of social media. So this gets at the notion that, children grow up in networks of surveillance and technology. Because they are growing up with this technology at their disposal, they have perhaps an inherent logic as to how this works, and they may be even better at explaining or understanding the nuances because it's so embedded in their social practices than adults. But no minor is the same, just like no adult is the same. And there is literature that supports the cases that, even the average layperson doesn't have the necessary digital literacy or digital health literacy skills in order to understand this idea of, okay, well, when I'm on the internet, is it private or is it public? When I post, is it private or is it public? And even scholars are still having this philosophical debate. So this wasn't inherently unique to this population because, again, it's going off of the assumption that children are unknowledgeable and incompetent in comparison to this, ideal adult figure who is inherently competent and knows everything and is, neurotypical. And that is just not the case. And especially when we consider in the context of social media, just the jargon and length and complexity of terms of service agreements can throw any, well-educated adult for a loop. So that was dismissed as well. The last thing that we'll get at is this idea of gatekeeping. And this was, for us at least, particularly unique to this population and the ways in which we are thinking through justifying our own ethical rationale for using digital data collection. And I will wrap this up in 2 minutes. I promise, Effie and Charlotte, thank you for not kicking me out. So again, when it comes to this idea of gatekeeping, especially in relation to a minor population, there are so many relevant stakeholders that will be involved, not just the parents and caregivers, but the researchers, as well as the research ethics boards and those members. So a minor's parents or guardians may ultimately provide access just based off of legal requirement, and as well give their consent. But depending on the gatekeeper's relationship to the minor, a minor's prospective participation in a study will inevitably hinge on whether it is found to be in their best interest to participate or not, and whether these gatekeepers are even willing to cooperate with the researcher to make the study happen. And again, this is where we get into the idea of research ethics boards as doing their due diligence to be primarily preoccupied with this idea of risk mitigation, but they don't have all the answers either. So although REBs seek to reduce potential harm while preserving the benefits of whatever research endeavor, they can still be problematic gatekeepers. And especially for those who are seeking to conduct researchers in new and contentious areas like online spaces and with digital technology. So there's an additive degree of uncertainty that inevitably pops up as soon as the word digital or digital technology becomes tossed out. So although REBs, are our bastion of the be all end all of what can actually be carried out in a research context, the literature noted that given this time in which everything is constantly evolving with technology and the social norms and practices and understandings, the boards themselves may not even be equipped to best guide ethical practices. So for us, we concluded that perhaps the ethical issue at stake is not the population or the topic of interest per se, but the rather ways in which gatekeeping may impede research that can guide or support opportunities for participants, and in this case, minors, to inform and shape understandings of their uncharted digital environments, which we all live in. So in turn, one of the resolutions that we wanted to propose after canvassing the literature was to implement child and youth advisory committees. So this is inviting that dialogic approach. This is co-producing ethical practice with minors in the most respectable way that we can fathom from our perspective, to inform how we carry out research in this uncharted environment, especially when the nature of everything is constantly evolving. So for us, gatekeeping was a unique ethical issue because it's a necessary safety measure to ensure minors are not taken advantage of, but it's also a potential barrier to their participation because of this contentious area. So again, if gatekeeping is necessary, but at the same time, perhaps foreclosing research opportunities, what do we do? So this, again, idea of co-producing ethical practice for us was the best possible resolution to put forward. And it's something that we are going to start exploring as a team. And this has been taken up in areas already in research with minors and digital technology and or other sectors in terms of agricultural labor and the hazards that come up with that when it's minor workers, self-advocacy for pediatric patients with chronic illness, and issues related to cyber safety. So for us, co-production in our context is risk mitigation. It is us doing our due diligence and offering the best practice to move forward with this kind of area. It's not an antidote to risk by any means, but it's an approach to working with the participants that we want to engage with to foster the best possible ethical practice when using digital technology to collect their data. So I am at 41 minutes and I am going to stop sharing my screen because you have been incredibly patient, and I'm so thankful that Charlotte and Effie didn't mute me. That is a lot to take in, but I'm so appreciative for those of you who hung on the line. And I see that Lorie is here, so thanks, Lorie, for stopping in. I'm so glad that you could make it. So Charlotte, I'll turn it back to you.
Well, first of all, thank you so much, Danica. And I think this is the moment where we would all be clapping and give you the chance to, yeah, we can do that virtually. Great.
Thanks, everybody. I appreciate it.
Give you the moment to just breathe a little bit and, have a sip of water. The things you do after talking for 30 or 45.
Almost off, but we moved past it, so that was good.
Yes, thank you so much for this, for sharing this with us. And we'd now like to open the floor. Do you say that in English? I'm not even sure.
Yeah.
What I'm trying to say is we now have time for discussion. So if you have any questions for Danica, please, just do the little hand raise on Zoom, and we'll be watching the participants list and see if anybody has something to comment or to ask.
And if you don't, that's okay too. I'm not going to be offended.
I am just okay. We have a question from Alex. Feel free to unmute yourself.
Hello.
Hi.
That might work a bit better. Let's see here. My question is a little bit hard to articulate, but basically, this was a very whirlwind tour of everything that you were doing here. I'm afraid I don't think I actually understood all of it that well. Just so I can grasp onto something a little bit more solid, would you have this is really unfair to say, but like the abstract version? So this was done and this was done and okay, thank you.
Yep, absolutely. Thanks, Alex.
Just sorry. All right, we have another question from Eugenia, or a question or a comment.
Go ahead, yeah.
Sorry, guys. Thank you, Danica. I hadn't put him on my camera. First of all, I want to say amazing work. It is astonishing to see how much you're doing and how many amazing people on campus you're working with, some of very impressive and diverse and interesting questions. So my hat goes off to you. My hat also goes off to the fact that you explained all of those different projects methodologically in ways that were succinct and yet clear, interesting. It's solid work. So I'm just your biggest fan since the last week. I want to ask you about the question of power and how explicitly this is coming up. I mean, obviously in the scoping review, obviously it's all about power. And in the scoping review, you're asking in a very precise way, what are about issues of power? But when you're talking with participants in particular, because in every quote that you read, there was a kind of subtext of of resistance and resentment and struggle with power. But is the word said, like, is it explicit for them and explicit in the way you ask and the way you proceed, I guess?
In terms of, is this in reference to the mothers, or is this in reference to like the minor population, like with kids and adults? Sorry,
You can choose. Yeah, go ahead and choose whatever of your work best answers that, I think.
Yeah, so since Lori's on the call, I actually wasn't the one to do the focus group interviews for the transition to parenting with the mothers. So whether or not Lorie wants to chime in, you're more than welcome to, Lorie. But the other piece that I can at least speak to, that I'm going to be really interested to pursue in my doctoral work, because I do intend on working with children and their parents, is, again, power is inherent to any kind of research or context. I've been reading a lot of literature and thinking about and writing about the ways in which voice comes up in that context, and whether or not power is actually discussed or explicitly articulated through words as something that's going on. There's a lot of really rich literature that talks about interviewing or speaking with populations as a researcher, but in particular minors, where there's that very distinct adult-child dynamic, and looking for and reading into nonverbal cues and language to see the ways in which power is like actually affecting them. So again, this idea of a participant or a child voicing something to you in an interview is, again, a very particular iteration of what they feel they can say at that moment, but it's looking at their bodies and what they're doing or what they're not saying. So there's some work by, I am blanking on his name, but I can send it to you if you're interested. He does a lot of work on silence in the context of interviewing vulnerable populations and children and adolescents. So looking at the ways in which silence or what's not said can even be more of an accurate read as to how like an interview or discussion about something is going. Because again, this idea of the research context and dialogic context where we can have a back and forth, power is just all consuming in that. So again, what someone may feel like they actually can say or not becomes really key. So for me, at least, that's something that I've been reading and working with some other researchers on, because moving forward, when it comes to what I'm going to assume, if I can get ethics clearance to do some kind of interview in a virtual setting or socially distant, like I'll be really hyper aware of that, because until I read that literature, I didn't think of it in that way. Right? It's like the taken for granted assumption that what a participant says is their authentic, true feelings in that moment, when there are so many like external factors that are, mitigating that whole interaction. So Lorie, if you can hear me, I'm not sure if there was any way in which you wanted to talk about power in the context of the transition to parenting and mothers, but oh, hi, there you are.
There I am, yeah. I'll just speak really briefly, Danica. I'm in full agreement with Eugenia about the amazing job you did today, but have been doing consistently through the time that we've been working together. But Eugenia, the work or the question that you asked around power, it wasn't explicit for the women that were involved in the study. They acknowledged it in, I think Danica used the term tension. They experienced it or embodied it in some of the structural impacts, and they were able to recognize it but not label it. So they felt it, but I think because the use of technology is so assumed and subsumed that it's really hard to clearly see that as an impact. And that some of the technology was taking on, some of human characteristics. So when we talk theoretically about the socio-technical relationship with technology, they really were talking about an evolving relationship with technology that was, as we're experiencing or witnessing from the data, was quite gendered between the mother parent versus the father parent. So lots more to come and to develop from just that bit of data. Yeah.
Thanks, Lorie.
Good question.
Thank you, guys. Great to see you, Lorie. Yeah, thank you.
Okay, do we have more questions or comments for Danica? Zach, go ahead.
Hey, Zach.
Hey, sorry, I'm gonna leave my camera off. I haven't showered in the last week or so. So that was a great job. It was really interesting. And one of the things, so I kind of have two questions, kind of related to maybe the first part of the talk. I was kind of interested, one is like, what kind of apps were they using, or what kind of programs were they using? And then the other thing I was also, you kind of mentioned like, I think period tracking apps and stuff. And so I'm wondering what are kind of the common ones, and maybe how do they work in terms of the way they collect surveillance? But then also the other thing I was wondering is, how do a lot of healthcare professionals treat these apps and platforms? And because, you know, one of the questions is that a lot of them are kind of bogus in terms of their science, in terms of what they're collecting measurements. And like, I'm thinking of the new Apple iPhone, which, you know, measures like a weird number of things that are kind of useless, and in terms of how, what they claim that they're able to kind of collect too. I know you're kind of focusing on surveillance, which might be a little bit outside of what I'm asking. But I'm kind of wondering, like, what is the general perspective on healthcare professionals, or are they encouraging individuals to kind of adopt a lot of these different platforms and applications as ways to understand themselves?
Yeah, so to touch on like a couple pieces that like you mentioned. So in terms of the apps that the mothers were using, I don't have that at the ready. If Lorie remembers off the top of her head, she can chime in. But from just by virtue of my identity as being a cisgender heteronormative white woman, I have looked at fertility tracking apps, and there are, you know, they vary from software developer, but in terms of like the actual data that they're asking from the user to input, it largely falls under, you know, areas of inputting into a calendar when your cycle begins, and detailing like down to your mood, appetite level, body temperature, and like the nature of the actual like menstrual cycle itself. So there's an extent to which it's kind of an external diary of what's going on internally, or your best subjective position on how you feel like you can describe what's happening with your body. Again, deferring to Lorie in terms of my expertise isn't in fertility tracking by any means, but from colleagues and friends who I know have used this, and from what I've read in the literature, sometimes there is the way in which like an app can enter the physician or clinical context as a tool to help aid in the dialogue between physician or a gynecologist and their patient. The actual credibility from a clinician or physician perspective on, you know, fertility tracking apps as a good or appropriate tool to do so, I can't answer that, but it's also a question that I'm really curious of, just again, by nature of how intimate that is. Lorie, did you want to jump in on that part?
Just to add to some of the question around the apps. So some of the apps were certainly pre-conception, and Danica's been talking about the fertility trackers. There were a lot of prenatal apps. So once conception had occurred, what to expect when you're expecting, which has been kind of a primary resource in hard copy in kind of the olden days, the textbook form, but has been made into an app. And just fetal progression, growth and development. And so there was one very popular app, one that was developed for mothers, and then a version for the father parent role. And that was the size of the fetus or the growing infant, over the course of the time in utero. And so, a grain of rice versus the size of a cherry versus the size of a grapefruit. And so it was aligned with fruits and vegetables. And for, when we talk about some of the gendered impact, for the male partner, it was more sports aligned. So it was the size of a golf ball, and then the size of a soccer ball or a football and a baseball. And so different information around that. There is actually an app for labor, so to count the contractions. And so there was an interesting conversation by a young parent who talked about the fact that she was paying more attention to, or she and her partner were paying more attention to the app than the actual contractions. So they threw that away as they got closer and closer to the time of delivery. And then lots and lots of apps and just questions around, or information gathering around what's normal, or what would be perceived as normal. And so access to information 24 hours a day. And the kind of the expediency of access really trumped sometimes the accuracy. So when young parents couldn't get a hold of a healthcare provider, they would certainly rely on an app or access to Google or some kind of search engine online to satisfy the tension that was existing around what was normal and what wasn't with either themselves or their child. So there's just a huge number of apps that are available, some of them much more popular or well-known than others, but right across the transition.
Yeah, and thanks, Lorie. And to Zach's other point, in terms of from like a clinician perspective, that's one of the knowledge outputs that Lorie and Dr. Hall and Dr. Jackson have identified as building this database of vetted, apps and also credible health information sources for parents. So that will at least mitigate this, wading into all of the corners of the internet to try and find something to help mitigate this tension, to have, again, something that can be vetted from an academic and clinician perspective as, yes, you can count on this in lieu of, a conversation with a healthcare professional, or when you're in like that state where you need something immediately, like where can you turn to? Lorie, did you want to add to that, or?
I just want to let Zach know that there's lots of research space.
Yeah, Zach, come on over.
It's a huge question, right? And so there's lots of opportunity for some really good research around the development of apps. And I know Danica is well versed in some of the policy development around these apps and user agreements. And so, Zach, I think it's a really important question and really something that needs to be followed up on. In my opinion, there's not a lot of insight by healthcare providers with the use of apps, which ones are good, which ones aren't, and what constitutes something that's credible from non-credible. So I think there's a huge research opportunity there for you and others. Danica, you're back on.
Oh yeah, thanks, Lorie. I'm just reading Alex's question. So what do you think this area should end up looking like? Alex, is that in reference to the parenting context, or the research methodology and using digital tech to track participants? Just for clarity, both. Okay, so I think Lorie did a great job like answering the and their intersection. Yeah, so in my personal opinion, in terms of, the parenting support, it's getting vetted health information resources. In terms of, when it comes to tracking using digital technology, it's making that dialogic approach in space. So not holding all the expertise or expecting academics and research ethics boards to have all of the answers for something that is constantly evolving. So in both of those cases, it's involving having a multitude of stakeholders who are given the opportunity to weigh in on what constitutes the practices and expectations and ideas of normal in those spaces at their intersection in particular. So again, this idea that from in utero, children are online in like the most broad sense I can put it. You know, as soon as they are logged into or, you know, tracked through some health record system in a hospital by that visual technology that's doing the ultrasound, they are in like a digital network already, which is just a really interesting, like, philosophical thing to wrap your head around, that, you know, especially in North America, this is the world we live in. So one of the things that at least I am interested that could fall within that intersection is, yes, the idea that they are born in that, sorry, not that they are born in utero, that they start in utero in networks of surveillance, are born into the world into more even intense networks, because they have to move through different sectors of society that are all there to support their well-being and growth. It's finding ways, at least for me, and something that I hope to do with Lorie in my doctoral work, in particular with digital health literacy, is figuring out ways to start including children, or opening up this conversation of, yes, this is the way that our world works, but there are ways in which we can help you maybe understand, or, you know, give children actual literature that's targeted at them from like a writing perspective, to be complemented with policy that is accountable for the ways in which, yes, this is the way the world is, but it doesn't have to be. And we can be really accountable to the ways in which we do policy and we do research, and we invite people into the conversation, being cognizant that, you know, that's on us, and those are the moves that we can make. So again, North America has a very particular way of operating, but even spots in Europe or in the Scandinavian countries and the Netherlands, you know, they take a radical approach in different areas. And, you know, you can just do a Google Scholar search about how they're talking about privacy in schools already, how they're implementing curriculum from like a publicly funded educational perspective that's already blowing this up, because they're identifying the long-term problems or opportunities where this can become a problem. So to start taking accountability for that, because they're complicit in the systems that they uphold and continue to build and, dare I say, profit out of. So thanks, Alex.
Okay, do we have any more questions or comments?
All I see is Yimin and Grant's face staring back at me, and it's so lovely because they're both so happy or goofy. Thank you for your screensavers. It's helped.
I'm not seeing any more raised hands, so in that case, I'm just going to hand it over to Daryl real quick.
Okay, thanks very much. First of all, thank you, Danica, for being the guinea pig in this process. So this is our Zoom-based mediations, and I think I hope Danica enjoyed the experience. Certainly I did. I think it worked really well, which is good, because we don't really have a lot of options at this particular point. What I want to say, though, I just want to take a few minutes to let you know about what's coming up. We had a bit of a late start with mediations this year, and so we're doing a little bit of catch up. We have a bit of an ambitious schedule. In 3 weeks, we've got Charlotte, who is going to be talking about amplifying women's concerns in a time of crisis, a study of women's rights organizations on Twitter during the COVID-19 pandemic. And then the following week, we'll have Ellis talking about social media and the House of Fame. And then 2 weeks after that, we'll have David talking about interrogating conspiracism, exploring the motivations behind the academic treatment of conspiracy theories. And we will be putting the descriptions of all of these talks on the Mediations Facebook page over the weekend. And on Monday, I'll be sending out an email reminding you of these 3 upcoming talks with links to where the descriptions are, where the abstracts are. So hope you will mark your calendars with the 3 remaining mediations talks. Thank you for coming to this one on behalf of the Mediations Committee. And Danica, I want to thank you for coming and participating today. So that's about it. I'll hand it back to Charlotte now.
Yeah, I have nothing more to add. Thank you for that, Daryl. Thanks everyone for joining. Thank you so much, Danica, for presenting. Have a fantastic rest of your day, and we'll hope to see you soon. Bye, everyone.
Thanks, everyone.